Meantime, tens of millions are said to lose their corporate coverage as well. Think that's a bit much? Well, to American Enterprise Institute, Stan Veuger, who's been crunching some of the numbers, and says that's pretty much spot on. How would it work then, Stan, and what would behoove a company to do so?
Well, so look, there's two different categories of companies here. So there's firms that just buy health insurance from an insurance company, and they'll be subject to very similar regulations as people in the individual market. So a lot of those firms will see that their plans are going to have to change to comply with the new regulations that come into place, and they'll make them a lot more expensive in many cases, and in some cases they'll choose to drop them. Even larger companies that often self-insure will also face changes because their plans will be subject to a range of new taxes. They'll make it attractive for them as well in many cases to make changes.
All right, but for a lot of companies seem to pounce first with their existing retirees for whom they might provide health coverage now, and they might rethink that, either getting them off the coverage altogether, switching them to private and or public exchanges. Do you expect that trend to accelerate, let's say, a year from now?
I think it will certainly happen, especially for firms that have many relatively low-income employees, because for them, new insurance plans that comply with all the regulations will be very expensive relative to their total compensation. So I think it'll be especially firms like that, like either construction firms or firms that provide security guards, they'll reconsider.
Obviously, they crunch those numbers, as you say, and they look at the cost of continuing the coverage as is, taking a penalty if they dump it all together. I would imagine few would dump it all together, but the math is making it more compelling to do so, isn't it?
Yeah, for sure. Also because for example, things like the Medicaid expansion have made it a lot more attractive for firms to just say, okay, well, why don't you just go enroll in that, and that way we can both save some money, and the taxpayer will just pay for your health insurance.
Amazing. Amazing. Stan, thank you very, very much.